practitioners here to discuss that, and then afterwards there'll be a short intermission with some snacks, and then the second panel you have your choice between sexual health and cannabis and cancer. So if you need help finding those, just find anyone with a name badge and we'll redirect you. And then after that, we'll have our student panel. So these people are competing for scholarships. It will be students of current medical professional programs, and they're talking about food as medicine. So I'd like to get started today by introducing our panelists. I'll give you a quick background, and then if they have anything to add, please feel free to do it. Mic check, please say hello, make sure that I hear you, and we'll get going. So on your left is Dr. Anna Wilson. She's a PhD. She's a licensed clinical psychologist at OHSU for the Child Development and Rehab Center. She conducts research on functional outcomes in adolescents with chronic pain and is developing treatment protocols to decrease pain and disability in youth, as well as providing behavioral assessment and treatment at the Pediatric Pain Management and Coping Center. So if you guys could help me welcome Dr. Anna Wilson. Next is Dr. Forrest Cooper, who has his doctorate of acupuncture and Oriental medicine from the Oregon College of Oriental Medicine. And he also teaches and practices there. He's currently teaching Tui Na, massage, and acupuncture. He's also published several peer-reviewed journal articles about pain. Please help me welcome Dr. Forrest Cooper. Dr. Richard Newman is a doctor of chiropractic who practices several different technique systems, including applied kinesiology, integrative kinesiology, biokinesiology, neuroemotional technique, one brain, frequency specific, as well as many others. He's also a developer of the HEART system. Help me welcome Dr. Richard Newman. And then Dr. Jason Black is a naturopathic doctor who got his bachelor's at the Evergreen State College, then went to NCNM for his naturopathic degree. He focuses on restoring the health and damaged tissues resulting from injury or inflammation. He also is certified in prolotherapy and neurotherapy at the University of Wisconsin. Please help me welcome Dr. Jason Black. So I have a few topics to discuss, and then if you guys have any questions and we have time at the end, feel free to come up and use the microphone or address the panelists if you have any other questions. We'll start with, how do you address the topic of pain in your practice? Specifically, what is your primary tool of choice? So we'll start with Dr. Anna.
Sure. This is working? This is working. Okay. As a pediatric psychologist, I'm in probably a unique position where I'm in an integrated team of providers seeing kids who have chronic pain conditions. So I have the privilege of working with a pediatric anesthesiologist and a physical therapist, and we have some alternative providers that we work with also at OHSU, and so it's really pain in many of the kids that we see. We think of pain as being that is the disease state that they're presenting with. So we are often seeing kids who have already seen a lot of specialty providers for whatever their condition is, and those providers have not been able to identify a clear cause for their pain, or it's poorly managed in terms of the typical Western medicines haven't been helping. So we really take a full team approach, and we look, I think, beyond just the physical systems of a child's body. We're looking a lot at social and family systems as well, and really trying to come up with individualized plans for getting kids back to functioning and reducing pain. So it's a little more, it's fairly comprehensive, and I think outside of just
Yeah.
the kinds of things that you might get on a physical exam, I guess.
Thank you. Dr. Cooper?
Hi. So I've worked mostly with musculoskeletal pain, a lot of sports injuries, motor vehicle accidents, those kinds of things. And mostly I use acupuncture and Chinese medical massage, Kuina, where we do a lot of work on both the musculoskeletal system, but also on the meridian system. And a large part of my diagnosis is combining both the orthopedics and the TCM, the traditional Chinese medicine, and reaching a TCM diagnosis as well as an assessment based on the orthopedic and the physical exams, and coming up with a treatment to treat both those. Getting an accurate pattern identification as well as an accurate assessment of the cause of the pain in terms of the musculoskeletal system are both equally important, and so I work with both those.
Thank you. Dr. Newman?
Thank you. I'm a doctor of chiropractic, and I was substantially pain-oriented, although I had a comprehensive view. Most people don't know, even if you've got experience with chiropractic, that chiropractic originally was not a pain approach. It was originally an idea of how to understand why the nervous system is not functioning properly. And so whatever else we don't understand about pain, we pretty much agree that pain is a problem in the nervous system. And so the chiropractic really is the science and art of the nervous system. The scope of practice and definition in the state of Alaska, which is where I happen to practice, I was just passing by, like I said, but it seemed interesting, is it's detection and correction, assessment and correction of abnormalities in the nervous system. And that's the definition of chiropractic in Alaska. And so our method has been to evaluate. Turns out that spinal problems are probably the most common disturbance of the nervous system. Not the only disturbance, but probably the most common, the most overlooked, in fact. And someone's going to have to make a dent, by the way, in chronic pain, because I didn't myself appreciate the statistics. I happened to look them up the other day. Look at the American Academy of Pain Management. There's 100 million Americans. I don't know if that's the kids too, but 100 million Americans are in chronic pain. Some of that's cancer pain. So we got to make a little bit of a dent here. And you of course know the recent statistic about the middle-aged men who have, for the first time in history that it's been recorded with middle-aged men 45 to 55 are now experiencing higher mortality. Their mortality rates are going up because of suicide, overdose of prescription and recreational drugs, opioids and so forth. So bad situation. A lot of it is due to pain and so on. So my finding would turn my practice in a direction of reducing my pain was the fact that we cracked the problem of inflammation. Or let me not crack it, but we realized that inflammation was everything. So you got myositis, you got neuritis, you got arthritis, you got spondylitis. It's all inflammation. Everything is inflammation, certainly in perpetuation of pain. So the nervous system is an electromagnetic phenomenon, whatever else it is. So in a holistic model, which we find is necessary, everything works. Acupuncture works, psychology works, massage works, chiropractic works, everything works. The question is what's going to work on this patient at this particular time right here. And so selectivity is everything, and that's why we need to be holistic. And so what tends to be missing, and what I feel is an important contribution, is electromagnetic medicine to modulate the nervous system, to restore the nervous system to its normal state. And when we understand inflammation, it's massively complicated. Maybe I'll get some insight myself today. Somehow that imbalance in the circulation, the nervous system, the tissues that are involved may have to do with an electrical disturbance, maybe a free radical factor, but I can tell you that we see just immense, massive turnarounds with using appropriate electromagnetic pulse therapy on the selected sites in a selected way.
Thank you. Dr. Black?
Good afternoon. I'm glad to be here. Everybody can hear me okay? I'm just curious, like, what type of people we have in the audience, like naturopaths, raise your hand. I'm a naturopath, so raise your hand. Okay, there's a few. Chiropractors? Okay. Acupuncturists? Okay. Psychologists or behavioral therapy? Okay, good. Okay. So anybody else who have an MDs? Any MDs out there or DOs? No? Okay. So I'm a naturopathic physician. I graduated from NCNM. I've been in practice for 13 years. I kind of happened, I've always been drawn to pain, and I don't know why. It just sort of is something that is, you get a natural gravitation once you get out of school, as far as like you feel like this is your calling. But like as far as like what I tell my patients who come in with pain is the first thing I ask them is, what does that mean? What does pain mean to you? Because I think it's a very wide range of experiences. I think there's a lot of structural issues you have to deal with, like the neurological system, what Dr. Newman was talking about, but there's definitely a mental emotional component that I have been honing in on more so after probably the last 6 years. And so I have a psychologist in my practice, and we have I have 4 other physicians that kind of work alongside of me. Some of them do a lot of nutrition, some of them do specialized like blood analysis. We look at methylation issues, we look at pyroluria. We look at just like imbalances that can kind of create that psychological state that may have an impact on their experience of pain. But the first thing that, most of the patients when they come in is, just really asking what that means. Because I think chronic pain is such a mixed bag, so to speak. And there can be a lot of trauma that's happening, but what we do know is if you're not treating